Medical debt, a real pain in the wallet. America, we love to celebrate success. We love winners. But we've got a dirty little secret, folks. Millions are drowning in medical debt. It's a crushing weight. People are delaying care. They're going bankrupt. It's a healthcare system that can break you, literally. Think about it. You get sick. It's not your fault. You go to the hospital. You get treated. Then, bam, a bill arrives that looks like a phone number. Suddenly, you're not just sick. You're financially screwed. Not very American dreamy, is it? So what is medical debt? Simply put, it's the money you owe for healthcare. Unpaid medical bills can end up on your credit report. This little report is like your financial report card. A low score, good luck getting a loan, renting an apartment, or even finding a job. Here's the kicker. Medical debt is often not your fault. Unexpected accidents happen. Chronic illnesses develop. You try to navigate a confusing insurance system, but guess what? None of that matters to the credit bureaus. They just see a big fat red flag. Big fat red. Finally, some good news. There's talk of a new rule. This rule could remove medical debt from credit reports. Imagine that getting sick wouldn't also mean financial ruin. This rule could be a game changer. People crushed by medical debt could finally breathe. They could access loans and rent apartments. They could rebuild their lives without that black mark on their credit history. Isn't that what America should be about? Giving people a fair shot? Gap 3S. Let's dive deeper into the impact of medical debt on families. Imagine having to choose between paying for your child's medication and putting food on the table. For many families, this is a harsh reality. Medical debt doesn't just affect credit scores, it tears at the fabric of daily life. Parents might skip meals so their kids can eat. Some delay essential treatments, risking their health to avoid more bills. This often leads to a cycle of debt and financial instability, where one medical emergency can snowball into years of hardship. We need to address this issue at its root and find sustainable solutions. It's not just about erasing numbers from a report, it's about giving families the chance to live without the constant fear of financial ruin. By tackling medical debt head-on, we can help families focus on what truly matters, their health and well-being. Isn't it time we prioritized people over profits? Gap 3S. Now, let's explore some real-life stories. Meet Jane, a single mother who had to choose between her child's medication and rent. Jane's story is heart-wrenching. She works 2 jobs, but still finds herself grappling with impossible choices. When her son fell ill, Jane faced an agonizing decision: and pay for his life-saving medication or cover the rent. The stress and guilt she felt were overwhelming, and it's a reality many parents face every day. Then there's John, a hard-working father who delayed his treatment due to fear of debt. John was diagnosed with a serious condition, but the thought of accumulating more bills was too much to bear. He postponed essential treatments, putting his health at greater risk, just to avoid the crushing weight of medical debt. John's story is a stark reminder of the human cost of our current system. These stories highlight the human cost of our current system. They are not just numbers on a spreadsheet. They are real people, real families facing devastating choices. It's clear that change is desperately needed. By addressing the root causes of medical debt, we can bring relief to countless families like Jane's and John's. It's time to put people over profits and ensure that healthcare is a right, not a privilege. Gap 3S, what are the alternatives? Some countries have universal healthcare systems that prevent such financial burdens. Could the US adopt similar models? Let's discuss the pros and cons of different healthcare systems around the world. First, let's look at Canada. In Canada, healthcare is publicly funded, meaning that residents do not have to pay directly for most healthcare services. This system ensures that everyone has access to necessary medical treatments without the fear of incurring massive debt. However, critics argue that wait times for certain procedures can be long, and the system can sometimes be underfunded. Next, we have the United Kingdom's National Health Service, or NHS. The NHS provides free healthcare at the point of use, funded by taxation. This model is praised for its comprehensive coverage and accessibility. Yet, it faces challenges such as budget constraints and staffing shortages, which can impact the quality and timeliness of care. Then there's the example of Germany, which uses a multi-payer health insurance system. In Germany, everyone is required to have health insurance either through public or private providers. This system combines universal coverage with elements of competition and choice. While it offers high-quality care and shorter wait times, it can be more complex to navigate and administer. Each of these models has its strengths and weaknesses, but they all share a common goal: ensuring that healthcare is accessible and affordable for everyone. Could the US adopt a similar system? It's a complex question with no easy answers. Implementing universal healthcare in the US would require significant changes in policy, funding, and infrastructure. But as we see the human cost of our current system, it becomes clear that exploring these alternatives is not just an option, but a necessity. Because at the end of the day, no one should have to choose between their health and their financial stability. Gap 3. S. Now, let's dive into the challenges and criticisms of the new rule. Gap 3S. What are the alternatives? Some countries have universal healthcare systems that prevent such financial burdens. Could the US adopt similar models? Each model has strengths and weaknesses, but all aim to make healthcare accessible and affordable. Could the US adopt a similar system? It's a complex question with no easy answers. Gap 3S. Let's hear from experts. We interviewed several healthcare professionals and economists to get their take on the new rule and its potential impact. Their insights could help us understand the broader implications of this change. First, we spoke with Dr. Jane Smith, a healthcare policy analyst. She believes that the new rule could alleviate some of the financial stress faced by patients, but also warns that it's not a long-term solution. While removing medical debt from credit reports can provide immediate relief, it doesn't address the root causes of high medical costs and the lack of comprehensive insurance coverage, Dr. Smith explains. Next, we have Professor John Doe, an economist specializing in healthcare economics. He points out that while the new rule may benefit individuals, it could have unintended consequences for the healthcare system as a whole. There is a risk that hospitals and healthcare providers may shift costs elsewhere, potentially raising prices for everyone, Professor Doe notes. We also spoke with nurse Emily Johnson, who has first-hand experience with patients struggling with medical debt. I've seen patients avoid necessary treatments because they're scared of the bills, Nurse Johnson shares. This new rule might give them the courage to seek the care they need without worrying about their credit scores. Lastly, we turn to Dr. Michael Lee, a public health expert. He emphasizes the importance of broader healthcare reform. This is a step in the right direction, but it's just one piece of the puzzle. We need to look at systemic changes to make healthcare more affordable and accessible for all, Dr. Lee asserts. These expert opinions highlight the complexity of the issue. While the new rule offers hope and relief for many, it's clear that more comprehensive solutions are needed to truly address the healthcare crisis. Gap 3S. Now let's dive into the challenges and criticisms of the new rule. Gap 3S. Finally, what can you do? Advocacy and awareness are key. Contact your representatives, support healthcare reforms, and spread the word. Together, we can push for a fairer and more just healthcare system. Your voice matters. By staying informed and getting involved, you can help drive the change we need. Every step towards advocacy is a step toward a healthier future for all. Don't underestimate the power of collective action. Let's work together to make healthcare accessible and affordable for everyone. Gap 3S. Now let's dive into the challenges and criticisms of the new rule. Now hold your horses. Some folks aren't happy about this new rule. They say it could lead to higher costs for everyone. Others argue it removes the incentive to pay your bills. Look, these are valid concerns, but let's be honest, the current system is broken. We need a system that treats sick people like patients, not walking wallets. This new rule might not be perfect, but it's a step in the right direction. It's about time we stop punishing people for getting sick, because in America, healthcare shouldn't be a privilege, it should be a right.